Hello, my name is Hannah Bailey, and today I'll be giving an oral presentation over cognitive behavioral therapy, otherwise known as CBT. Today I would like to discuss two impactful creators of CBT and their specific therapies that are underneath this umbrella term, what the primary focus is for CBT, which people actually most succeed from this form of therapy, and an example case study as well. Now, Albert Ellis actually developed the form Rational Motive Therapy, otherwise known as REBT, back in 1955. Now, REBT's primary focus to its approach is to help people identify irrational beliefs or behaviors with negative thought patterns that may have led them to emotional or behavioral issues. REBT places a great deal of attention on the present situation of the client. REBT addresses emotions that may be determined unhealthy, such as anger, depression, anxiety, guilt, or even shame. And the behaviors that follow that seem maladaptive, such as procrastination, lack of sleep or sleep disturbances, substance abuse, someone's eating habits, and sometimes someone's aggression. Now, REBT focuses on these emotions and behaviors to try and improve one's life satisfaction and to help them progress through their life. Now, Albert Ellis believed there are three common irrational beliefs, and he actually coined this term, the three basic musts. They are: 1. I must do well and win others' approval, or else I am no good. 2. Others must treat me fairly and kindly and in the same way I want them to treat me. If they do not treat me this way, they are not good people and deserve to be punished. 3. I must always get what I want when I want it. Likewise, I must never get what I don't want. If I don't get what I want, I'm miserable. If we realize must 1, we likely feel anxious, depressed, shameful, or guilty. If we are not treated fairly as must 2, we usually feel angry and may act violently. And 3, if we don't get what we want per must 3, we may feel self-pity and procrastinate. The next impactful creator would be Beck, who actually developed cognitive therapy back in the 1960s. Cognitive therapy, also known for its abbreviation CT, has a primary focus on depression and inaccuracy one sees themselves. CT also dives into someone's emotions and behaviors, but also one's beliefs about themselves. One with CT may see themselves as unlovable, unworthy, helpless, and incompetent. Again, like Albert Ellis, Beck CT, he believed there are three dysfunctional, irrational beliefs that someone may have when it actually comes to depression. The first one goes, I am defective or inadequate. 2, all of my experiences results in defeats or failures. And 3, the future is hopeless. Together, these three themes actually create the negative cognitive triad. In session with using rational and emotive behavioral therapy and cognitive therapy, a counselor or social worker's main goal is self-motivation. Now, self-motivation is the force that keeps pushing us to go on. It's our internal drive to achieve, produce, develop, and to keep moving forward in life. Now, self-motivation means when you think you're ready to actually give up on something and you have no idea how to start it, your self-motivation is what actually drives you to go on. How to get one to achieve self-motivation is to ask open-ended questions. Don't interrogate your client or they'll become closed off, frustrated, and it may be with you or it could be their situation. This can lead to the feeling of incompetence or defeat. Now, once you have discovered their emotions and behaviors that are the underlying issue, it is actually up to the counselor to then guide these irrational thoughts and negative beliefs about oneself and allow them to actually construct rational and positive thinking habits. CBT is mainly focused on the population with disorders or mental health crises. Now, CBT has also been greatly recognized in treating children and adults with these mental disorders. Some of these mental disorders include depression, anxiety, phobias, PTSD, sleep and eating disorders, obsessive compulsive disorder, otherwise known as OCD, and substance use disorders, and many, many more. For example, on how CBT therapy is a helpful form of therapy to someone with these disorders, I actually read on the American Psychological Association a case study about a woman named Jill, who is 32 years of age and is an Afghanistan war veteran. Jill actually suffers from post-traumatic stress disorder, otherwise known as PTSD. She has been experiencing symptoms of PTSD for at least 5 years and actually began drinking consistently and heavily to push away the thoughts and memories of her comrades that were lost due to an explosive device while driving a supply truck. She actually reported having difficulty with her relationships, such as numbness or a disconnect between her husband and children, reoccurring night terrors, and has a difficult time with her employment due to missing multiple days. She describes the event to a counselor that she was in charge of a supply truck and the people who drove them. When her leading convoy was broke down, she waved her comrades on to go around them, and when they did, the truck had an explosive device, killing all that were inside the vehicle. She actually feels responsible for what happened to them. She discusses a lot of ifs during her session. She then had 10 sessions with her counselor after being diagnosed with PTSD. In these sessions, the counselor actually used a CBT worksheet that allowed the flow of conversation to happen. Now, the therapist goes on to ask her what protocols she had to follow. She asked open-ended questions like, what is the protocol for the broken down truck? And her response was, you have to fix it as soon as possible, otherwise you're a sitting duck. The therapist then listens and reasons and asks more leading questions to get down to the feeling of why Jill thought this was all her fault. The counselor then has her walk through what had happened and then talk about each associated feeling of what had happened. Jill lived with regret of her comrades dying because she felt like she could have done more and been more when in reality she wouldn't have known. Jill felt anger, mostly self-directed as well, which then in turn fueled her PTSD symptoms. The counselor chose to educate and challenge Jill's thoughts to help her work through it and possibly later on recover from her PTSD. Just like Jill, there are many people out there with different disorders that are assisted daily with CBT therapy. I personally chose this case study due to a kind of a hit of home, or a personal tie, you will, with members of the military or who have been in service, and the many sacrifices they have made, not physically, but also mentally as well. CBT has helped quite a bit of my own family members with different disorders as well. And reading from multiple case studies, it seems that it has helped many, many more. In conclusion, cognitive behavioral therapy is a useful tool to help people struggling with disorders or having trouble distinguishing their thoughts, feelings, and emotions appropriately. With this therapy, it gives people who have lost all hope to begin a new way of thinking and hopefully a new way of living. Thank you.